Welcome to Guide Guru. We hope this video helps.
You begin by confirming the dart's location and how it entered. If you suspect the dart hit bone, joint, eye, artery, or the chest, stop and get emergency care. Do not proceed. Assuming the dart is superficial and stable, put on gloves, cleanse around the entry with antiseptic, and stabilize the person. Once done, use a flashlight and steady both the limb and yourself. Gather sterile tweezers and a small sterile gauze so you can act cleanly and confidently. Now you remove the dart. You want a firm, controlled action. Grip the exposed shaft with sterile tweezers as close to the skin as possible to reduce tearing. If there's only a small barb, compress tissue around it to reduce snagging. With a single smooth motion, pull straight back along the entry path. This reduces further tissue damage. If you meet strong resistance, sudden pain, or arterial bleeding, stop immediately and get emergency help. Excessive force can worsen the injury. Once the dart is out, your priorities are bleeding control and infection prevention. Apply direct pressure with sterile gauze until bleeding slows, then clean the wound gently with antiseptic. Make sure to reassess circulation beyond the injury. Check color, warmth, and sensation, and keep the limb elevated to reduce swelling. Dress the wound with a sterile bandage and tell the person to update tetanus protection if needed. If you see increasing redness, pus, fever, or numbness, seek medical.
Thanks for watching. Consider subscribing if we helped you today.